Hello, good morning, everyone. Welcome to our session this morning. It's great to have you with us. I hope it's not too early or too late for you, but you've got an absolutely fantastic panel all ready to entertain you, to inform you, to educate you, and definitely to keep you interested in the session. So this session this morning is part of the 2022 Global Public Health Week, and today's theme is Achieving Public Health Equity. This session is arranged by the Lancet and Financial Times Commission on Governing Health Futures, and today we're going to discuss the implications of the Commission's report. We're going to hear from speakers from the global and country level, as well as perspectives from young people and funders. So today's agenda is quite simple. We're going to start off with a panel discussion and have some videos and polls along the way, super interactive, and there's also a chance for you to ask questions for the panel. Just a quick note, we're going to be using Slido through this discussion. Hope you've used it before, but if not, it's really straightforward. So you'll see a poll and a Q&A pop up on the left side of the WebEx window. Please use the Q&A within Slido, not the WebEx itself. And if you have any problems, just raise your hand in the WebEx chat for assistance and we'll be able to come and welcome you there. So firstly, to greet you, to better understand where you're joining us from today, we'd like to please ask you to use Slido now and answer the following question. Where are you joining us from? Where are you now listening to this discussion? So I hope everyone's found Slido and you're able to pop in your question, your answers, and let us know where you're joining from. Seeing some answers coming in. We've got answers: India, Switzerland, United Kingdom, another UK, London, Sweden. That's great to see the answers coming in. Well, welcome everybody, and it's great to have you here. The next question we wanted to ask you all is, what is your disciplinary background? So are you interested in public health? Are you coming from a medical or clinical background? Are you joining us with a kind of public health systems? Are you coming from a particular clinical specialty? So if you could answer us in the Slido, we'll be able to understand better where everybody is from, what's your perspective, and what is it you wanted to find out from this morning's session. So let's see, what do we have? Loads of people coming from medicine, from public health, anthropology, we have global health, we have an audience from Nigeria, global surgery research, fantastic, quality improvement, loads of different people joining us. So, well, good morning. I hope that everybody finds something interesting here. It's absolutely brilliant to have you all here. So, before we join our panel, we would like to give you just a few high-level findings from the Commission. Now, sure many of you won't be familiar with what a Lancet Commission is, but essentially it's 2 years worth of work, so a huge topic convened around an area which is usually underfunded or under-recognised. And one of the questions we got asked when we were talking about doing this Commission on Digital Health Governance is, you know, this is neither underfunded nor under-recognised. It's a ubiquitous area of our everyday lives. It touches every point the way that we live, the way that we work, the way that we interact with our family, our friends, other citizens in our country, people from over people joining us from other countries. We're using it here today. It's also certainly not underfunded. It's hugely commercial. It's extremely well funded. If you want to do some research in this area, quite often it's easy to get the funding to do that, or relatively, because people are so excited. It's such a kind of hyped area now. So why did we want to look at this? Well, really because when you think about the governance of digital health, especially when you're thinking about it through the health and equity angle, that is an area which is neglected and underfunded. So if you don't work for equity in any system, it doesn't just happen. We know this, and the digital transformation that we currently have is not equitable. The Commission, as you'll hear, found that it was dominated often by particular interests, certainly extractive business models, and there were many groups that are excluded from digital transformations, and therefore what governance needs to do is to kind of reset the balance. So what are the implications? What are the public health implications? Well, the Commission reported that there were direct and indirect implications. So direct effects are about the health information that you can access, whether the information is quality information, effects from many digital platforms about how to access services, but also thinking about social media. We've heard recently about the impact on mental health, but there's also indirect effects, thinking about education, work, all of the commercial other determinants that we understand to have an effect on health, which nowadays are viewed through the lens of digital. So what the Commission asks is, well, look, if this is the situation we have now, can we imagine another way? And so I'd like you to join us all as we imagine this other way and talk about the Commission itself, the findings, and how, coming up to kind of over 6 months after the Commission was launched, how these findings have been received. So I'd like to ask our support team now to help us with a video. So we're going to watch a video which is a quick coverage of the Commission. Apologies, I think we're having a problem with the video, so we're just going to try again and see if we can play it to you with the sound. Yeah, that's working for me now.
Our world is rapidly changing. Digital technologies and data are changing to health and the design of health systems, but governance models haven't kept up. This creates uneven effects globally. The Lancet and Financial Times Commission, Governing Health Futures 2030, Growing Up in a Digital World, shows how digital transformations are changing our health futures. In October 2019, 19 commissioners were brought together to develop the report. These commissioners considered a wide range of governance approaches, ethical guidelines, and institutional responsibilities that must be considered to improve health and well-being in an increasingly digital world. Commission meetings prompted open dialogue and shaped the heart of the commissioners' report. The Commission engaged with stakeholders, including various international organizations, non-governmental organizations, and decision-makers at the global and regional levels. The novelty of this collaboration between the Lancet and the Financial Times also allowed for private sector engagement without compromising the independence of the Commission. There were 3 key findings. First, young people's experiences growing up in a digital world are just as diverse as their lived experiences. They are excited about the benefits digital transformations will have for their health and well-being, but they are concerned about online risks, finding trustworthy information, knowledge on how their data is being used, and whether these technologies are grounded in human rights. Secondly, the Commission identified a solidarity-led approach to health data and addressing digital determinants of health to be important for maximizing the public health value of digital transformations. However, these are missing from most governance approaches. Lastly, we discovered that all countries are looking to use digital technologies to improve their health services and make better use of their health data. Most countries have already developed digital health strategies, but they are yet to adopt an approach based on the principles of data solidarity, digital trust, accountability, and public participation. The Commission found that these principles are key to advancing health equity and resolving privacy concerns. Digital transformation have the potential to improve everyone's health and will allow young people to have a role in making decisions about their health futures. But this is only possible if collective action is taken to strengthen the governance of digital technologies and data so they benefit everyone. For this to happen, governments, companies, and other organizations must take collective action by building a governance architecture that fosters trust, addresses the role of digital technologies as determinants of health, enacts a new approach to data collection and usage based on data solidarity, and invest in the enablers of digital transformations for public health and UHC. Our health futures are being decided now. If governments and companies adopt a value-based approach to governing digital transformations, everyone will move one step closer to reaching a sustainable future where health for all is realized.
Great. Well, what a fantastic summary of the Commission. So here with us to kick off this fantastic panel discussion, I'd love to welcome each of the panelists. So we have Dr. Kira Ullman, who's a public engagement researcher at the Ada Lovelace Institute, working to create public perspectives and lived experience in data and AI policy. Kira is currently co-producing ethnographic research with people who have lived experience of poverty about the impact of data-driven systems on health inequalities. Welcome, Kira. We have Dr. Ulla Jasper, Governance and Policy Lead at Fundación Botna, who's responsible for managing policy work and coordinating external relations and partnerships. We have Dr. Olubunmi Jitawa Winter, who's a clinical pharmacist, has a doctorate in clinical pharmacy and also an MBA in business administration, currently the executive secretary to Kuwara State Health Insurance Agency. And we have Dr. Rahini Dutta, medical graduate from Christian Medical College, Ludhiana, Punjab, India, who's also a global surgery fellow at the WHO Collaborating Centre for Research in Surgical Care Delivery in Low and Middle Income Countries in India, and a Global Health Futures 2030 Regional Youth Champion. So welcome to our amazing panel, all women, all doctors, all here with you to share their expertise this morning. So I'm going to pass to the panel for this first question. Now, health equity is a central tenet of the Global Health Futures 2030 report. In your opinion, how can governing digital transformations in health support, or what is required in order to deliver this, the achievement of health equity and the overall sustainable development agenda? So, Kira, can I come to you first on that?
Yeah, absolutely. Thank you so much for that wonderful introduction and such a great video overview of the Commission's work as well. From my perspective as an ethnographer working on these issues from sort of the ground up, one of the key things we need to consider in achieving health equity through governance of digital transformations is to think a bit about knowledge equity. So how do we actually include diverse knowledges in both the design and of the digital technologies that are becoming increasingly embedded in our everyday experiences of health and healthcare, and also in the data that we're drawing on to make predictions and in order to deliver better care to people and better experiences to people on the ground. This also means including more diverse perspectives in the actual governance of these technologies and data-driven systems and the interoperability of data sets. And so this means thinking creatively about how to create more participatory and egalitarian structures for managing data in the long term. A lot of the research in the UK that is emerging right now on public attitudes to data and data-driven systems shows that there's actually a really high level of trust right now in the use of data for health outcomes. So there's an immense opportunity right now, basically, to really empower and enfranchise people in the health sector and in relation to their healthcare, whereas there's a lot of skepticism in relation to data and data governance in other sectors. And so we really need to pay attention to this, and we need to grab the opportunity, basically, to actually to walk the walk and actually be deserving of that trust in this sector.
It's really interesting. Thank you. Ulla, does that fit with your experience at Fundación Botna?
Yeah, I mean, totally. I couldn't agree more, actually. And I think Kira provided a brilliant perspective. And I mean, I think what we know today is really that there is a broad consensus that if we want to achieve sustainable development goals, especially SDG 3, I mean, we have to leverage these technologies. We have to leverage digital and AI to make progress. And I mean, the benefits can be really, really massive. I mean, they can help us to bridge the gap in like service delivery and care, and they can help us to better train people. They can help us to overcome the last mile between or towards communities and healthcare delivery for communities, remote communities, for example. However, I think many of the questions that we are seeing today are fundamentally governance questions. We need to address those governance questions. And I mean, there's a broad range of questions and challenges that we are seeing. I mean, for example, if we look at access to technology, access also to education, to digital education, data literacy. It's a governance question. It's a governance role to provide access both to infrastructure but also to education. So the same with financing. I mean, we need massive increases in investment if we want to see the digital transformation of health succeeding. So this is also a governance question very fundamentally. And also what Kira said about data and data trust. I mean, here too we need to find a balance between on the one hand, protection of privacy and data sovereignty, but also we need to ensure that data gets collected, that it gets used. We need to ensure that there is a benefit sharing, you know, when it comes to the benefits generated from data. So I think this too is a governance question. And yeah, ultimately what we see is if we want to fully leverage the technologies towards achieving SDGs, then we need to address these governance questions, which are at the heart, I think, of the debate now.
Thanks, Ulla. Olabumi, how does that fit with your experience?
Well, I want to thank you for giving me the opportunity to speak here today and to the conveners. I say thank you. I really do agree with the two speakers, but however, in rural Africa, there's a bit of a challenge here because we mostly live in an analog world. We're transitioning into the digital world, and so there's a lot of barriers that we have to break through to be able to have a sustainable digital transformation that we're looking for. I think there has to be policies that support digitalization in Africa, in rural Africa. We also have a very diverse population with respect to capacity, financial capacity. We lack a lot of hardware and resources to be able to really digitalize. And when we talk about equity, you want to make sure that you carry everybody along and everybody, what you're providing is equitable to all and not just a segment of the population. And if you really look at it, where you have a substantial percentage of the poor, you also have to think about how do you provide governance in such a way that they don't miss out or lose out in what you're trying to do. So for us in Africa, there's a lot of challenges and that create barriers to how much digital transformations that you're looking for. And of course, the governance must also take into cognizance that you're dealing with many, many challenges and a diverse population, and everybody needs to be catered for. Thank you.
Yeah, thank you so much. Rohini, what's your experience?
So as a 24-year-old freshly minted doctor, I think I don't have as much experience as everyone else on the panel. But what I have noticed is that healthcare is widely inequitable, and that is not limited by borders. It's cross-continentally inequitable, and it's constantly leaving out people from low middle income countries. And even in high income countries, it's leaving out vulnerable groups like women, children, young people, people with disabilities, minority groups, and not to forget our future generations. So when we bring in digital technologies into an already inequitable space, we want to make sure that they don't exacerbate these existing inequities and even contribute to widening the gender digital divide. So I think to make sure that the governance system is actually catering for these populations, we need to proactively reach these populations at higher risks, that have higher risks of being left behind, and to reduce these equity gaps and dismantle the asymmetric power dynamics that are already there. And like we already know that statistics apply to populations and not individuals, but the reality is that this is how when we take treatment algorithms that are coming out through high income countries, through the data and research that is happening there, and applying them to low and middle income countries, it has consequences that we don't want the same thing to happen when we are applying digital technologies in these countries. So to achieve that, we need to have stronger policies and regulations which are equity centered on human rights. And along with that, we need to have avenues for public participation that put the minority and vulnerable groups at the forefront.
Thank you so much. So I'm going to ask the panel now, and Olubunmi, you've touched on this a little bit about the barriers to achieving health equity. So, Rohini, you played down your experience, but you speak so eloquently to the kind of problems that we're trying to address. So thinking about these barriers, I would also ask, what has your organisation done to bridge the gaps in health equity? So two parts of the question, what are the barriers, and what can your organisation do, or, organisations that you're exposed to? So I'm going to come back to you, Kira, first, if that's okay.
Yeah, definitely. Two really big questions there. I think so. In terms of the barriers, the reality, and this comes through, I think, very strongly in the Commission's report, is that the issue of digital inequity is very much rooted in social, economic, and political inequity, and so really, in order to identify the digital barriers, we also need to be paying attention to people's everyday lives. A lot of the challenges that people face are rooted in their everyday experiences and the conditions in which they live. This may be a lack of access in some contexts. It may be a lack of skills in other contexts. It may be poor digital design, for instance, in terms of the platforms that people interact with in order to access their basic needs, or in order to access information about their basic needs. And so I find that when I'm talking about barriers, I kind of tend to say the same thing over and over again, which is that sometimes the issue isn't actually about the technologies. It's not about making technologies more usable. It's actually about making people's lives more livable in the first instance, and then figuring out how technology fits into people's lives. An example of this is, people's changing life circumstances often create a barrier to equitable digital access and digital experience. This includes inclusion in data sets, for instance, as well as just accessing technologies and technological opportunities themselves. Things like losing a job can immediately mean that somebody doesn't have access to email, or doesn't have access to a smartphone anymore. And so suddenly that socioeconomic change in their life circumstances creates a barrier to actually accessing all of these other essential aspects of their life, and contributes really detrimentally to their health and well-being. And so it's important to recognize what we might call the socio-technical dimensions of the barriers that people face. And in terms of how we address this at the Ada Lovelace Institute, we do a lot of research in the field of health. We have an entire program focused on health and healthcare, and I work within that program on data-driven systems and downstream impacts on health outcomes. And we try to surface those inequalities at different levels of the system, from the system from designers all the way down to people's lived experience, which is the area that I focus on. And it's really important to understand how these different levels of a healthcare system, for instance, interact to either exacerbate inequalities or try to subvert and overcome them. We publish that research and we talk a lot with policymakers about how to address these inequalities. And really, this is kind of only the tip of the iceberg. I completely agree with what Rohini was saying just a moment ago about there being a serious need for greater public participation, actually not just in the design of the governance mechanisms, but also in the research process itself. So the kinds of things that my organization does and that many of us engage in.
Thank you, Kira. Ola, let's come to you.
Yeah, again, I mean, I couldn't agree more. I think this Kira mentioned already very substantial aspects, and I think probably one can distinguish 2 or 3 kind of streams of problems or challenges that we're facing. One is I think there's also there are technical barriers, or in the way we use technology, there are barriers to successful digital transformation. For example, we do still see quite a vast number of innovations which are fielded, but then never are brought to scale. They never reach scalability. They just remain as pilots, for example. There is often a lack of a comprehensive approach, like a comprehensive roadmap to pursuing digital transformation of health. This is a kind of a more technical problem that needs to be overcome. And this, of course, also has to do with kind of the fragmentation of global health that we see. I mean, a lot of these efforts are donor-driven, unfortunately, and not so much demand or needs-driven. And so I think, yeah, there often is a lack of a clear, comprehensive strategy of what needs to be achieved and what are the priorities, what do we want to achieve with that digital transformation. But then I think there is also a political or like a socio-political and an economic dimension to it. And of course, I mean, we see that many health systems and healthcare, broadly speaking, is often very unfair in the way it is designed. Many people are left out of healthcare. They don't have access. And that is fundamentally a political problem, I think. There's a political choice to the way we structure and we design healthcare and health services. So this is another question that kind of prohibits us from having more equitable systems. And yeah, of course, there's also like an economic, like a financing question. I mean, this healthcare needs to be financed better. We need to have the decision, governments need to make the decision to invest more into equitable healthcare systems. And so, yeah, I think there are 3 different kind of challenges or streams of challenges: the more technological, kind of almost mundane, practical questions, the political and the economic questions. With regard to the other part of the question that you asked, what do we do as an organization, as a foundation? I mean, we are very proud that we had the chance to support the Financial Times Lancet Commission on Governing Health Futures, and we are very excited about the report that the Commission has produced. I think the report contains very strong and very useful recommendations of what needs to change and what needs to happen. And I think one of the next steps that we believe is very important now is to create some sort of global movement, like a civil society-driven movement that really takes these recommendations and puts pressure on governments and also international institutions. And so we, together with other organizations like PATH and PMNCH, have created Transform Health, which is a global coalition which really tries to promote digital transformation of health systems in order to achieve equitable health care and health for all. And so I think, yeah, this is what we have done. We have been lucky to support the report, but we now really want to encourage people to create this movement and to demand changes. That's, I think, a little bit of what we do as a foundation.
Thanks, Ola, and obviously, you know, open to us to kind of pick that up, everybody on the call, to participate in the Transform Health movement that you've talked about. Olubunmi, you talked a bit already about the challenges as you've seen them. Do you want to expand on that a bit and perhaps tell us about what your organisation is doing or wants to do to take these on?
Well, in our organization, we had to take into cognizance certain barriers or the major barriers that would not allow everyone to have equitable access to healthcare services. We looked at the technologies and how ready we are to receive these technologies. For example, in the state where I come from, where about a population of about 3.2 million people, and going by World Bank standards of the poverty index, I would say about 40% of the population are poor. So that already creates a barrier because this affects literacy levels, it affects their buying powers. You know, do people own phones? I mean, what are the infrastructure that is needed for these people to have equitable access? Those are not there. We also have the physical barriers like the terrain where we live in. Some people, you know, for example, live in very far outreaching places where you can't even get to them. And the only means of getting to everybody at the same time is to use digital technology. But where people don't own phones or Android phones for you to be able to disseminate information, you have to look for practical ways that would work and introduce these technologies in very little doses, if you may. What we have done is to sort of decentralize what we do at the central at our office and go to seemingly big towns and look for sort of gatekeepers and identify them as stakeholders and train them, and information dissemination goes through them to the communities, so that we don't actually go directly to the communities, but we go through the gatekeepers and then ask them to disseminate information locally. Also, these transformations have to be tailored to realities of the communities where you want to implement these technologies. Where we just are trying to use maybe just, for example, WhatsApp, it's not available for everyone. So you have to go through these gatekeepers. Once you disseminate information to them, then you know they go do the footwork and try to do that. On our end, to improve transparency and accountability, of course, we use a digital platform, but that is for us to gain efficiencies and to make what we do transparent. But then when you talk about inclusiveness, of course, a segment of the population is really not going to enjoy what you're doing or benefit from what you're doing at the same pace as people who live in the metropolitan cities where they have access to, you know, phones and things like that that can allow them to enjoy what you're doing. So to bridge those gaps for us, we have to actually do a hybrid um, information dissemination. We don't go all digital, but we give it to them in such a way that it can further be disseminated in an analog way, so to say. So we don't, the terrain, the connectivity is not there. And so even if you wanted to introduce these technologies, you have all these barriers to deal with. And you just have to look for the best way to disseminate without having to cause people any more discomfort.
Thank you so much. So, Rahini, before we come to you, I just want to give the meeting a bit more of an introduction about some of the work that the Commission did with youth that you were part of. So we've heard your expertise today, and we're so grateful that you were able to work with the Commission. So the Commission identified working with youth as being fundamentally important. Many people would say, you know, young people, they're this kind of very tired idea of digital natives. And I think the Commission, what the Commission exposed, is that this is a myth. That the experience of young people is completely different. It's diverse. But young people are definitely growing up in a world which is being affected by these digital transformations and are therefore more exposed, but have less agency often in terms of setting their future. So one of the things that the Commission did was by co-creating the many aspects of the report with young people and talking about how health futures need to be co-created with young people. And we were really lucky to have some support from the Swiss Agency for Development and Cooperation, and the Commission could set up several youth work streams. And those work streams included the creation of a youth team, several global and regional consultations so that we could hear from youth, and those perspectives were not kind of presented separately, but like directly informed the work of the Commission, integrated into the report, were able to be reflected separately. So I'm really kind of, I can see as the editor kind of handling this work how important that was to producing the kind of interesting, fresh, innovative messages of the Commission, but also how it created something which was kind of, authentic. Not saying, not talking about young people, but really hearing from those people themselves. So it's great that we now have 6 regional youth champions, and Rohini, you're one of those. And so many bad things about COVID, but one of the good things was that we were able to hear people's voices when we join in this kind of remote way. Olubumi's told us that, this isn't ubiquitous, but it was one of the benefits to switching from working in a physical way to a kind of online way. So we would like to share a second short video with you, which was created by the youth authors of the Global Health Futures 2030, and who also created a youth statement, a call for action, and partnered with the Commission report. So there were 35 young people representing 23 youth networks from 21 countries, so really wide-reaching. So I'm going to play this video now, and then Rohini, I'm going to come back to you.
Today, we call upon all the policymakers to recognize the potential of digital race generation by giving them access to opportunity, resources, and access to use the digital as a critical tool to challenge the current norms.
We call on young people to join the government, launch social enterprises, support the academe, and empower civic groups so that together we can champion human rights-based health policies, improve digital health literacy, invest in innovative digital health technologies, and boost youth participatory governance towards a healthier, more inclusive, and a more sustainable future in a digital world.
What we are expecting as youth in the launch is the meaningful engagement of young people in the decision-making processes when it comes to the development of health governance models that dictate the standard of health and well-being of youth. This can be achieved through addressing the critical considerations and call to actions regarding the future of our well-being and safety in the digital world.
Intersectionality in the conversation of human rights in the digital age is non-negotiable. Youth are not a monolith, and as such, our diverse, unique experiences must be the focal point in these conversations. Stakeholders must ensure that youth are not an afterthought, but are active participants in the creation of our own future.
So Rohini, if I could ask you to think, again, another big question, but in your experience, what are the barriers to achieving equity? And what do you see as the role for youth in advocating for and contributing to governance of digital health transformations in health in order to kind of safeguard these health futures and reduce health equities? How can youth tackle this question?
Thank you so much. I'll answer the first part of the question regarding the barriers, and it's something that's already been discussed regarding literacy. I strongly believe that an individual's ability to benefit from these digital transformations requires them to have the knowledge, skills, access, and agency needed to make free and informed choices that act independently in relation to all the technologies and data that is evolving around them. So to create public value and contribute to universal health coverage, digital health needs to be underpinned in 3 spheres of literacy, which is digital, health, and civic literacy. which can easily help decrease the inequities that we are seeing in healthcare. To take the example of India, 84% of women here between 2019 and 2021 were literate, but only 33% of them had access to the internet. So that is clearly shown that that if women are better educated, they and have increased access to technologies and tools, it does not equate to them having adequate knowledge or the experiences in how to use this information and resources correctly. Which is why I feel that supporting literacy in both the health and digital spheres is needed to co-create better health futures for all. And coming to the youth, I think the biggest thing is involving them, which is what you're doing with me by having me on this panel. I think that my youth perspective is being valued, and that is the first step in definitely creating sustainable health futures with youth at the center of it. I also feel that because as the youth, more and more of our data is being measured, coded, and stored than ever before, and we are extremely vulnerable to have the people and the organizations that control these technologies to influence our decisions and behaviors. And it puts us at risk of online privacy infringement, manipulation, and abuse. And I think with the youth, there is a stark divide even between countries, where there are young people who can leverage these technologies to support their health and well-being, and there are many that cannot. So bringing all of these diverse perspectives together in advocating and contributing to governance of digital transformation is to bring their realities and experiences to the forefront of policy discussions. And I think that these heterogeneous experiences can generate intergenerational action. And at the same time, I think that governments and technology companies should not just listen to the youth regarding digital innovation alone, but also about their recommendations on improving internet access and the quality of healthcare. In the commission and the youth statement and call for action, the youth called for three main areas in the future of health governance, which was a human rights-based approach to health, digital skills education and innovation, as well as strong and inclusive health governance. And as a young person myself, I truly believe that our lived experiences with our skills make us experts in our own rights. And this must be recognized, valued, and leveraged through collaboration across sectors to amplify our voices for greater civic and political engagement, as well as participatory research, like we've been discussing on this panel. And I think that's the key to safeguarding our health futures.
Thanks so much, Rohini. So we want to come now to our audience, to the participants, and ask you, well, firstly, for your thoughts, and then secondly, if you have any questions. So we're going to post a question for you all in the Slido, which is looking ahead, how can including young people in the governance of digital transformation of health promote health equity and safeguard health futures for generations to come? So Rohini's given you the perspective of a young person, but we'd love to hear from our participants. Are there other ideas? What can young people do to work on the governance of digital health transformation? And also, do you have any questions for the audience? What would you like for the... I need a coffee this morning. It's still a bit early in the UK. So do you have any questions for the panelists? Given everything you've heard, what would you like to ask them? What more can we put their expertise to use to this morning? So just looking now to see if that question's going in. Whether are there any questions? So while the questions are coming in, I'm going to put one to you all, which is thinking about the recommendations of the Commission. Just being told that there are questions and I just haven't got them. Okay. Right. The Commission's report has got lots of recommendations to strengthen governance of digital health. What are the priority steps to implement them? So what are the priority steps? How do we take these recommendations and move them into action? So Ola, perhaps I'll come to you first. and then I'll go round the participants and ask them of the recommendations of the Commission. I was going to ask, which do people find are the most important, the most helpful, but then what are the priority steps to implement them? So Ulla, I'll come to you.
Sure, thanks, Naomi. I think it's an important question, also a tricky one, though. Because I really believe that the Commission report contains strong and many very strong and good and important recommendations. So it's always a bit tricky to say which one is the most important. However, I mean one critical issue area is probably data governance, health data governance, because I think we need to make sure that there is a strong protection of individual and community health data. And if we don't have that, if we don't achieve that, people will probably lose trust in. I think Kira can say more about it because she referred to it in the beginning. But if people lose trust in how the digital transformation of health is governed, and especially if they lose trust in how data is protected, then they will not really participate in the digital transformation of health, and they will not believe in it. So I think, building some sort of trust architecture to govern health data is probably one of the key issues. However, if I can just continue for 30 seconds, I think what's equally important is really to ensure the financing aspect. I mean, we need to make sure that there is a clear list, that countries develop a clear list of priority areas in which they want to invest in order to use digital technology to achieve more equitable health care systems. So I think data governance is a critically important aspect, but the economic and the investment side is equally important. And there are many others, and I'm sure my colleagues will have more to say and other views maybe.
Kira, let's pass over to you.
Yeah, I mean, I think that was a great note to start on this question, because I agree that data governance is a huge issue, and that it's actually such a difficult question to think about where to start, because the reality is that we actually have to kind of start in every corner of this problem simultaneously, and we have to address all of these challenges at the same time. I would say the best way of thinking about it is actually to recognize that all things digital and data related are not a separate domain or sector. They're not a technical problem purely. They're not a problem for people who are just purely focused on the implementation of technological solutions in the healthcare sector, for instance. Digital is something that we actually all have to be thinking about, regardless of what sector, what piece of the problem we're addressing. And I think bringing up the issue of trust was such an important one in relation to data governance, because I think there's often a misconception when we talk about the governance of digital transformations, that when we're talking about public trust in that process, that what we're talking about is just convincing people that our use of data and that digital transformation is trustworthy. How do we convince people? But actually, that's kind of looking at that question of trust the wrong way around, I would argue. Fundamentally, we actually have to put in place trustworthy systems for people to have trust in the system. It's not about convincing people that what we're already doing is the right thing. And so I think it's always important to unpack that piece of the trust equation, that actually one of the most important recommendations, I think, was around enfranchising patients and vulnerable groups, which is something all the panelists have talked about a bit. And that enfranchisement means being more participatory, being more inclusive, looking at the issue of digital as an intersectional issue, and making sure that that's actually built right into the governance frameworks that come into play. That is the basis of trustworthy technologies and digital transformations. And then we will be deserving of the public's trust in sort of the rollout of these technologies. So I would say, thinking about what those questions are is really crucial. And I'll just give one very quick example. From the Ada Lovelace Institute, we recently released a report that may be of interest to some people tuning in today on algorithmic impact assessments as one way of trying to build this trust. And we use an example from the healthcare system in the UK, looking at the National Medical Imaging Database, and how we might engage the public actually in participatory algorithmic impact assessments in that that space. And so, this is just one tiny piece of a very, very big puzzle, but it's the piece that we've been working on, for instance. And I think that's the key. Wherever you are in the system, think about how you can try to strive toward greater equity in sort of the piece that you're working on.
Thanks so much, Kira. Olubunmi, let's come to you. Is data governance also an issue where you're working? Is that an action of the Commission?
Well, partly, but I'm going to emphasize more on financing health, because to build trust in people, the government themselves have to seemingly show that they are interested in catering to the healthcare needs of the population. Where there's increased financing, people tend to see the government as really supporting them, and it helps them to relax their guards, so to speak, and be more participative. Also, allowing people to take ownership of what you're trying to do makes it all the more inclusive. In areas where we have a lot of cultural barriers to accessing digital transformations, you would see that making people now take ownership of what you're trying to do and making them more participative would help you to achieve greater results. For us, we tend to utilize the youth more in how we implement processes, because somehow they have a connection to the community, and especially if they come from those communities and they're young, they're still agile, they can transmit information in a way that people can absorb it and build trust. But financing healthcare services is at the core for us here in Nigeria, because there's very poor financing of health. And of course, it limits your capacity to do so many things in those areas. Thank you.
Thank you, Olubunmi. Rohini?
Hi. So I completely agree with the financing of a health infrastructure, because in India, what we're seeing right now is that the government is trying to scale up the healthcare services within the existing resources of infrastructure and as well as human workforce, which isn't exactly the best way to go about it. I also think that digital technologies need to be tailored in a way that they empower women and children to use them more, which we see from a lot of mobile health applications. And what we can also benefit from the diverse public participation when we are designing these technologies is when, say, someone says that there are internet connectivity issues, which are all over the world, not limited to just low and middle income countries. But then we can design systems that are tailor-made to them. So, for example, the interactive voice response system or the short message service system, which does not need a smartphone, it does not need internet access, but it can also allow people to access digital health, which was being used in the COVID-19 pandemic in India. But also when you see about the COVID-19 pandemic, there was a lot of misinformation being spread. So how can we stop that? And how can we make sure that there are organizations and laws that are holding people responsible for spreading this misinformation that have negative effects on people's health? And the question was also about the priority areas. I think that a lot of people mistake that digital health tools are trying to replace current in-person health services, but in reality, they are complementing them. So understanding that and aiding existing healthcare services where digital tools are helping you, but they are not replacing the in-person doctor-patient consultation is important.
Thank you so much. So we're coming just into the final 3 minutes of our session, and we opened the session today talking about, are digital transformations important for health equity and public health? And I think you've just heard from our amazing panel for the last hour about how important they are. I do, in the 3 minutes we have remaining, want to ask our participants if they can give us a final one-line closure, because I think, you were the stars today, the stars of the show. So, Olubunmi, can I come to you first? Just one line. What do you want people to take away from the session today?
That digital transformations help us to improve efficiencies, It allows for transparency and accountability, but also we must recognize that we must break those barriers for us to be able to optimally use those transformations for better processes, for better operations, and we cannot ignore those things if we really want to achieve.
Thank you. Rohini?
I think it's pivotal to include vulnerable and marginalized communities to drive governance by public purpose and not private profit. That will ultimately bend the arc towards social justice when we are introducing digital transformations to increase access to health equity.
Kira?
Yeah, I think I'm going to return to something I think I said at the very beginning of the panel today, which is that digital equity and relatedly health equity are very much rooted for me in knowledge equity and thinking about epistemic justice. So how we include a wider range of perspectives genuinely, not just in our data and in the design of the technologies that are relevant to health and healthcare, but also in the actual governance, management, and ownership of those technologies. So we can actually strive toward greater social justice in relation to health equity and health outcomes.
Una?
Yeah, I think my kind of summary would be, if we really want to achieve the Sustainable Development Goals and especially SDG 3, I think we all know that we have to make use and we have to leverage digital technologies and AI in some sense or another. But how well we will realize the digital transformation of healthcare and whether we will manage to do so without doing harm really depends on the political choices that we make, I think. These are fundamentally political questions, and we should not believe that just because we have the technology, or that we should not believe that the technology on its own will improve people's health and people's well-being. It's about making political and economic and social choices, I think, and these are at the heart, I think, of the debate nowadays.
So thank you so much. We're at the top of the hour. I'd like all of you to join me in thanking the amazing panel that we had today. They were eloquent, they were interesting, they were informed, their expertise shone through. So thank you to all four of you. It was an absolute pleasure to hear from you this morning. And we'd just like to ask you, finally, you've heard so many calls to action today from the panelists. And if you would like to continue the discussion with the Governing Health Futures Commission, please join us, follow us on Twitter. We have a youth network, and we're going to send you the link to read more about the Commission if you'd like to. But I think I'll use Kira's words, which is, I think, work in your part to improve the equity, push in the area that you can work on, and we look forward to hearing from everybody in the future about the work that you've done. So thank you so much to the Commission for bringing us together. It was an absolute pleasure to be here with you all this morning. So thank you. Have a good day.
Thank you.
Thank you. Thank you, everyone.
Thank you.
Thank you.